Hi everyone, welcome back to Oncopath Simplified. Have you ever wondered why some tumors respond very dramatically to immunotherapy while others do not show any effect at all? The reason often is a single molecule, that is PD-L1. In today's video, we will simplify what this PD-L1 is and why does it matter. So as we all know, whenever there is any foreign material entering into our body mounts an immune response against it. So once that is taken care of, it is necessary that the immune activation is inhibited. Because if that is not done, then the immunity will start harming our own body cells. That is autoimmunity. And hence for this reason, the body has certain immune checkpoints. Basically, these are the molecules which will inhibit the immune activation once the job is done. And one such checkpoint pair is PD-1, PD-L1. It is basically a braking system that normally prevents excessive immune reactions. Now let us first see in detail about what this PD-1, PD-L1 is. PD-1 is basically a programmed death 1 receptor, which is a transmembrane protein receptor. It is encoded by PD-CD1 gene on long arm of chromosome number 2. Normally this is expressed on activated T cells, B cells and NK cells. Coming to PD-L1, it's a programmed death ligand 1. It is normally expressed on antigen presenting cells like the macrophages or the dendritic cells and even some normal tissues like that of placenta and lung. And this PD-L1 is also expressed on tumor cells. Now let us first understand how this PD-1 and PD-L1 they act in pair. So as we can see in this diagram, we have an activated T cell with PD-1 and an antigen presenting cell with PD-L1 or PD-L2. Now whenever there is an antigen presenting cell in the body, T cell is going to come to attack it. However, whenever the T cell comes, the PD-1 on this T cell, it recognizes the PD-L1 or the PD-L2 on the antigen presenting cell. This bond is formed, and whenever this bond is formed, it gives an inhibitory signal to the T cell, which leads to its reduced activity, decreased cytokine release, decreased proliferation, and ultimately this suppresses the cytotoxic function of this T cell. Now this is a normal self-tolerance mechanism and it prevents tissue damage after immune activation. This leads to a balanced immune system. Now what exactly happens in cancer is basically these tumor cells, they exploit this mechanism. Like they start overexpressing this PD-L1 to hide or evade from the T cell attack. So whenever the PD-L1 from the cancer cells, it goes and binds with the PD-1 on the T cells, the immune system is going to become inactivated and the tumor cells will escape the immune destruction. So in a simple language, you can say that the PD-L1 is tumor's camouflage against the immune attack. So in a simple language, think of PD-1 as a brake pedal on a car. Here our car is a T cell and PD-L1 as the signal which tells the car to stop. That is, the PD-L1 will tell the T cells not to mount any immune response. And cancer cells are the one which will keep on pressing that brake to avoid being destroyed. But the good news is we also have the checkpoint inhibitor drugs which can actually cut this brake line and that will allow the T cells to attack again. So what do these drugs do? They will block the PD-1, PD-L1 interaction and they will ultimately allow the T cells to remain active and attack tumor cells. Now herein we have two classes of drugs. With one are anti-PD-1 wherein they will block the PD-1 receptors on the T cells and other are the anti-PD-L1 drugs. They will block the PD-L1 on the tumor cells. The only method available right now for PD-L1 testing is immunohistochemistry and in many tumors it has become a routine. However, whenever we report this PD-L1, we always give a score. We do not say whether PD-L1 is positive or negative. And this score that we derive from of the PD-L1, it helps us to decide whether the patient is eligible for immunotherapy or not. Now what we understand from all of this is there are certain types of cancers which are going to use PD-L1 as a primary immune evasion mechanism. But is that the only way to evade immunity? The answer is no. So basically, PD-L1 expression is biologically significant only in certain tumor types where it basically acts as a dominant immune suppressive pathway. So you can think of PD-L1 testing like checking for fuel type before you refuel your car, right? If your car runs on diesel, then you cannot give that car petrol. And if it is a petrol car, then you cannot put diesel in that car because it's not going to help, right? So similarly, the tumors or the cancers which basically use PD-L1 as a primary mechanism to evade the immunity, only in those cases will the immunotherapy work. In other cancers, which wherever it is not a primary mechanism, immunotherapy is not going to be very helpful. Remember one thing, PD-L1 testing is not a diagnostic marker. It's a predictive biomarker, meaning we can predict from the score that we get whether the immunotherapy will work in this kind of tumor or not. So it's done only if a PD-1, PD-L1 inhibitor drug is approved by FDA or it is clinically indicated for that kind of cancer. If no approved PD-1, PD-L1 drug exists for that particular tumor type, PD-L1 IHC is not going to help, it will not influence any management, and hence it is fruitless to perform PD-L1 IHC in that case. This is a list of certain cancers wherever the immunotherapy is approved and hence it is routinely tested. So as you can see in the last column, we have a TPS and a CPS, that is a tumor proportion score or a combined positive score. So as you can see in a non-small small cell lung carcinoma, you have a TPS. In other cancers, you have CPS. How this TPS and CPS is derived, we will see that in a separate presentation. So to conclude, PD-L1 is not a universal marker. It is only performed in those cancers where the PD-L1 blockade has proven benefits, where the scoring system has been validated, and the testing has actually impacted the treatment decisions. Before we sign off, I have a brain teaser for you. Which of the following statements regarding PD-L2 is true? A. PD-L2 is expressed predominantly on all tumor cells similar to PD-L1. B. PD-L2 binds exclusively to CTLA4 receptors to inhibit T cell activation. C. PD-L2 is a ligand for PD-1 receptor and primarily expressed on dendritic cells and macrophages. And D. PD-L2 expression predicts response on anti-CTLA4 therapy in melanoma. I will be posting the answer next week. However, I would appreciate if you can post the answers in the comment section below. Thank you so much for your patient listening. In the next session, we are going to learn more about this tumor proportion score and a combined positive score, in which tumors we use a TPS scoring system, in which tumors we use a CPS scoring system, and how to derive these scores. So till then, have a great day, have a great time. Take care.